Hi, I'm Emily Warren with the Kansas City Police Crime Laboratory,
And I'm Paige Anderson from the Missouri State Highway Patrol Crime Laboratory.
and we'd like to introduce you to the Missouri State Sexual Assault Evidence Collection Kit. Let's take a look at the top of the box. You'll notice that there is a place to put the patient's name, the time, date, and place of the collection or the hospital name, and your name as the collector. Also, if you know the law enforcement agency's name and their case number, please write that on the box. You'll also notice that there is a location to put the law enforcement agency's representative and the date and time that they take the kit into their custody. Now let's take a look at the inside of the box and go over evidence collection. Anytime you're doing a sexual assault examination, it's important to always wear clean, powder-free gloves. And we also recommend that you change those gloves frequently throughout the exam to prevent contamination. We recommend that you collect evidence in the order of most perishable to least perishable. You'll also begin most examinations by asking the patient to change into a hospital gown. At that time, if the patient is okay with you collecting her clothing as evidence, and if it is the clothing that was worn either during the assault or immediately after the assault, meaning she had not bathed or showered yet, please collect that clothing separately in paper bags. We recommend that each item of clothing be packaged separately in its own paper bag. Please label the paper bag with the contents of the bag, meaning if you collect a shirt, write that it's a shirt. Also include the agency name and case number if you know it, and a patient label so that the clothing can be associated back to the correct patient and the correct kit. Also, make sure that you tape seal each bag closed so it cannot be opened, and add an evidence seal. The purpose of an evidence seal is to maintain chain of custody, or to show that nobody could have opened the bag after you collected it. That means it's important for you to add your own initials and date on every evidence seal. Now let's get into the kit. Now let's take a look inside of the kit. Each kit includes its own instruction card, so don't worry if you get lost, you can follow the steps on the card.
Also inside the sexual assault evidence kit is the sexual assault examination form. Please fill this out with all the information possible. This really helps when we do our examinations at the laboratory.
Now, when the victim is removing her clothing, if she is wearing underwear, and if it is the underwear that was worn either during the assault or immediately after the assault, you can package that in the underwear bag that is included in each kit. Just make sure that you tape that bag closed after collection. Place it in the kit box. Hairs are also very perishable, which is why it's important to collect them early on. If the patient has pubic hair, you will want to collect a pubic hair combing. Each kit includes a pubic hair combing collection kit. That consists of an envelope and a comb. We recommend that you also get a paper towel. When collecting the pubic hair sample, hold that paper towel underneath the pubic area and gently comb the pubic hairs. Your goal is to gently collect any hairs that could be from the perpetrator while not pulling out any of the patient's own hairs. Once you are done collecting the combing, place that comb in the paper towel with the loose hairs. Fold the paper towel up. Place that paper towel in the envelope and return that envelope to the kit.
There is also an envelope for collecting fingernail scrapings. You'll want to be sure to collect these if the patient indicates that she scratched the suspect. Inside this envelope, there are 2 pieces of paper, one for the right hand and one for the left hand, and there are also 2 collection sticks. Hold the patient's hand over the paper and gently scrape under the nail to collect any debris or fibers. Place the stick in the paper, fold it up, return it to the envelope, and repeat with the other hand.
Now let's talk about oral swabs. Oral swabs are very different from buccal standards. The purpose of an oral swab is to collect any body fluids from the suspect that could remain in the patient's oral cavity. That means you want to use 2 swabs that are included in the kit at the same time and pay special attention to the oral crevices, the gum line, and underneath the tongue where any body fluids from the suspect could have pooled. Place both swabs into the pre-labeled box, close it, and return that to the sexual assault kit. Now let's go over the buccal standard. The purpose of the buccal standard is to get a sample of the patient's own DNA. The crime laboratory will use the buccal standard to help them determine what DNA on the samples belongs to the patient and what DNA could belong to the perpetrator. After you collect oral swabs, the instruction card will tell you to have the patient rinse her mouth out with water and discard that. Do not collect the rinse. You do not need that as a sample. Use 2 swabs that are included in the kit, 2 at the same time, and rub the interior cheeks of the patient. Place those swabs into the pre-labeled swab box and place that into the sexual assault kit.
Next, you will want to do the external genital swabs. You will want to do these before you do any internal swabs to prevent sample contamination. Again, there are 2 swabs contained in the kit. Rub the swabs over the external genital area and place those swabs inside the box and place them in the kit.
After you have collected the external genital swabs, you can do your speculum exam and collect the vaginal and cervical swabs. We recommend collecting the vaginal swabs first, then inserting the speculum for your speculum exam, and then collecting your cervical swabs. If you have a male patient, you will replace these samples with a penile swab and a scrotal swab. Just be sure to label your boxes appropriately if you do have to make this change. If a rectal assault is reported or suspected, you will also want to collect rectal swabs. We recommend that you collect both swabs at the same time in order to keep the sampling on each swab about equal. However, if the patient is unable to tolerate 2 swabs at the same time, it is allowable to collect 1 swab at a time. Each kit also includes extra swab samples. This allows you to customize the kit to your patient based on what she tells you happened to her during the assault. For example, if she states that her attacker licked her on her neck, you will want to collect that sample because it's a very good sample to collect. Just make sure that you label appropriately where on that patient's body you collected that swab from. Also, make sure that you detail in the sexual assault examination form why you collected that swab. It's always important to document why you collected all of your extra swabs.
If you take a pubic hair combing, you will also want to take a pubic hair standard. Pull, don't cut, approximately 25 hairs from the patient's pubic area. Be sure to collect those after the pubic hair combings so you're sure you're only getting victim hairs. If the patient cannot tolerate that, just get as many as you can, collect those, put them in the envelope.
If the patient does not have pubic hair, then you do not have to collect a pubic hair standard or a pubic hair combing. However, you can use your extra swabs to collect a pubis swab sample if you feel that is necessary. If you need to collect a head hair standard and the patient is able to tolerate it, we recommend that you pull 50 hairs from all over the head to get a representative sampling of the victim's head hair standard. Again, if the patient is unable to tolerate this collection, that's okay. Notate it on the envelope and return that envelope to the kit. Now let's talk about properly sealing your evidence kit. Once you have all of your items packaged inside of the kit, make sure that you can fully close the box. You don't want any samples to be pushing the box open or to be sticking out of the box. There is evidence tape included inside each kit. Make sure you place that over the opening of the kit, tape it down firmly, and initial and date your seals always. You may wonder what happens to a sexual assault evidence kit after it leaves the hospital. It may go to a crime laboratory where a DNA analyst like Paige or I will look at the evidence inside of the kit. We will use the form and documentation inside of the kit to help us most effectively analyze the evidence. Our jobs as DNA analysts is to try to find DNA from the perpetrator of the crime to help in investigations in sexual assault cases. We'd both like to thank all of the SANE nurses who do what they can collecting evidence for sexual assault survivors. You are making a difference to the survivors in Missouri. Thank you.